Jess Begley, and she's a policy lead, Global Climate and Health Alliance. I'm going to read our intro, about, and hand over the floor for her to make her presentation. Ms. Jess Begley is a policy lead, Global Climate Change and Health Alliance, and she works with, she has a focus with UNFCCC, that is United Nations Framework on Climate Change. And she's been working with them at the national level and international level. She works to raise the profile of health as a driver of ambitious climate actions at COPs and other UN climate processes, and to support the engagement of the health community in meetings and written submissions in alignment with the priorities of climate partners. To access the inclusion of health and clean air consideration in national climate plans, Jess conceptualized and developed the methodology for GCHA's NDC scorecards. She also contributes research and analysis to inform GCHA's priorities and has a particular interest in lessons from tobacco control and how this can be drawn on to reduce the influence and health harms of the fossil fuel industry. Jess has over a decade of experience in evidence-based policy and programs for public health and environmental determinants, having previously worked with the Lancet Countdown on Health and Climate Change, the Non-Communicable Disease Alliance, and the International Diabetes Federation. Jess completed an undergraduate degree in physiological science at the University of Oxford and a master's in health in urban development at University College London. Jess, we're very happy to have you on this platform today. You have the floor, please.
Thank you so much, Dr. Bobadaya, and it's a really great pleasure to be here with everyone today. Thank you so much for the invitation. So as Dr. Bobadaya already said, I work with the Global Climate and Health Alliance, and part of the work that we do is when we're following the UNFCCC negotiations, we try to identify where the health entry points are into different opportunities in the UNFCCC space, making sure that health is always framed as a driving rationale for ambitious climate action, and respecting the human right to health and the human right to a clean, healthy, and sustainable environment. I do work for the Global Climate and Health Alliance, and I am therefore not qualified to speak with credibility on Africa's position on climate and health at COP29, but I would love to speak through some of the recommendations that we've identified as being appropriate at international level, and to, using my own thinking, try to apply how these might relate to the African context. But I would really welcome being corrected on anything that I miscommunicate, and to take the chance to discuss further. So thank you so much. To start off with, to give a little bit of background on the current context on how we're seeing dialogue on climate and health gain momentum at international level. So at COP28 in Dubai, we saw the Climate and Health Declaration, the first ever of its sort in the UNFCCC space, endorsed by over 150 governments to date. There were also guiding principles that were announced for climate finance, and $1 billion of finance at the intersection of climate and health specifically. This was followed by the second ever climate resolution at the World Health Assembly. The first one was in 2008. And that has an accompanying global plan of action. We've also seen climate and health in WHO's latest strategic plan, the General Programme of Work, that will run for the next 4 years. Addressing climate and health is the top priority in that strategic action plan. So we've got great decisions being made on climate and health, but we're not yet seeing health be reflected in depth in the negotiating rooms. So at SB 60, which is the mid-year meeting of the UNFCCC to prepare for COP, we finally started to see the first parties really integrating health as part of their messaging, calling for ambitious climate action, but we haven't yet seen outcomes from those meetings that are specific that are sufficient to protect human health, and we're not seeing health mainstreamed in the COP negotiations. But we do have an opportunity, on account of the fact that the Climate and Health Declaration was endorsed at the last COP, and the 150 governments that endorsed that stressed the importance of integrating health more deeply into the UNFCCC space and linking it to the negotiations. So the recommendations that I'll present are really building on that commitment and reaching out to governments, to parties, and to explain how they can follow up on that proposal. And to briefly touch on what we expect COP29 to look like. So the first point is not health specific, but it's absolutely health relevant. COP29 is the finance COP. It's the COP at which developed countries are due to increase their commitment and in provision of climate finance to developing countries. The UNFCCC still speaks in terms of developed and developing countries. I realise that those are not the most appropriate terms in the wider global space. But it's really important to mention that without adequate finance, it will be impossible to deliver climate action, and that would be catastrophic for human health. So although we're not seeing health explicitly mentioned in this finance discussion, it's the most important discussion that we're going to see on health at COP29. In addition, WHO will launch a special report on climate and health. The date for that is to be confirmed, and there'll also be a health pavilion that's hosted by WHO with events throughout the 2 weeks of COP. The 18th of November is designated as Human Development Day, and that will include a focus on health and a high-level roundtable on One Health and climate. On the 20th of November, there's an Urbanisation Day, and there'll actually be the launch of a declaration that focuses on resilient and healthy cities, so really seeing the intersections between health and urban development and climate there. And then there's also a COP Presidency's Continuity Coalition that we're expecting to see launched. And that will look at lessons that are learned from one COP presidency to the next on how to embed health in the negotiations and more widely at COP. So these are the 9 recommendations that GCHA has identified through consultation with the global climate and health community. We want to see follow-up on the COP28 Declaration on Climate and Health. We want to see health embedded in national climate plans, nationally determined contributions being one of them, and to see strengthened intersectoral coordination to support that. We need, as I've said, an ambitious new finance target. The name of that is the New Collective Quantified Goal. We want to see a just phase out of fossil fuels and a rapid and just transition to renewable energy, knowing that that is a major public health imperative. We need holistic adaptation, both in the health sector and across sectors. And there are discussions at the moment at UNFCCC level on how to monitor progress towards this kind of adaptation. We absolutely need an adequate loss and damage response. Loss and damage has been left far behind in the UNFCCC discussions. There is now a fund, but the fund does not yet have adequate funds within it, and a fund is not useful unless it's adequately capitalized. We need resilient and sustainable agriculture and ecosystems, recognizing that without resilient agriculture, we won't be able to achieve nutrition security. And in addition, that developed countries have especially high emissions from agricultural production, specifically from industrialized agriculture and heavy reliance on livestock. So a responsibility of developed countries to act there. We note that there are many lessons that can be learned from international policy making on health, including with the exclusion of the tobacco industry from tobacco control policy making, and yet we see huge participation of the fossil fuel industry and other polluting industries that harm both the climate and health in the UNFCCC space. So we want to enhance the integrity of the UNFCCC discussions. And finally, we want to see collaboration with the most impacted communities, because we can make all of the policy that we like, and unless it's done with the most vulnerable communities in mind and meaningfully involved and engaged and fully participating, then we will not be serving those that are most in need. So I'll speak to those in a little bit more detail. Please let me know if I'm getting close to time and I can speed up. So to follow up on the COP28 UAE Declaration on Climate and Health, we're proposing biannual health and climate ministerial meetings in the UNFCCC space. We saw the first of these at COP28, and we're proposing biannual because it would mean that there is time to go and implement action, and then that civil society can apply pressure every 2 years for that action to be adequately reported on. We don't think it's productive to draft a new declaration at this point. We think it's much more important to focus on delivery of the first declaration. And as we've seen momentum build in the UNFCCC space and the WHO space, and indeed the G20 space, we wonder if it's time to consider holding a UN high-level meeting on climate and health at UN headquarters in New York, because of the gains that would offer for improving intersectoral cooperation and financing and monitoring based on what we've seen from high-level meetings on other health issues. Many governments are currently updating their nationally determined contributions, their plans to deliver the Paris Agreement. We would argue that an NDC is not healthy unless it limits warming, unless it's in line with limiting warming to 1.5 degrees Celsius, reflecting the historical responsibility of developed countries for emissions and present capabilities. We want to see action across sectors which also optimize health co-benefits, so the ways in which we reduce emissions can have increased gains for health. So in the transport sector, if we're reducing emissions, one way to do that is to invest in electric cars. But if we were also to invest in active transport infrastructure, then we would see not only improvements in emissions reductions, but we'd see better improvements in air quality. We'd see better improvements in road traffic accident reductions, in physical activity improvements, and better mental health. And on the adaptation side, if we keep nutrition security at the center of how we build agricultural systems rather than trade alone and economic gain, then we're going to see better outcomes for people. We want to see time-bound targets and indicators for implementation of actions and delivery of health outcomes, because we know that actions are very nice to write, but unless they're time-bound, it's difficult to ensure accountability. We need to make sure that there are financial considerations reflected in NDCs, both for domestic action, but also internationally, to make sure that developed countries are providing finance to developing countries for the implementation of those actions. And finally, all of this will be supported by the establishment of national multi-sectoral climate and health coordination mechanisms that can support dialogue across sectors. On finance, as I've said, we need to adopt a new collective quantified goal. The current climate finance target is $100 billion a year. This needs to be in the order of trillions of US dollars annually. We need sub-targets on mitigation, adaptation, and loss and damage. Historically, a lot of climate finance has gone towards mitigation. And we've seen adaptation much less well funded, and loss and damage was only funded to 0.7% of the level that was needed at the end of COP28. That finance needs to be based on grants, not loans. We heard from the Africa Group of Negotiators in Bonn at SB60 that currently those countries are spending more on repaying climate finance than they are on healthcare and education, because of the ways that climate finance is structured. And we need fiscal policy reform. There are currently over $1 trillion invested in fossil fuels annually, with huge costs as a result of those subsidies, meaning that the total implicit and explicit subsidies are in the range of 7 trillion, with many of those additional costs being due to health. On just energy transitions, I've already spoken about how this is the responsibility of developed countries to move fastest and furthest on. While those transitions are taking place, it's absolutely vital that energy access is maintained and improved, that people's livelihoods are protected, and that occupational health hazards are avoided. And we know that all of those are major social determinants of health. We need to avoid false solutions and dangerous distractions. We're seeing growing dialogue around carbon capture and storage, around coal co-firing with ammonia. And not only do those solutions, so-called solutions, not work to reduce emissions at the scale needed, but they also don't address the health harms of fossil fuel extraction and processing and transport and waste management, all of which impact health through air, water, and soil pollution, before we get to the point of combustion itself and the climate change that results from that. we need to protect against the health harms of critical mineral extraction. We need critical minerals to build batteries for renewable energy storage and for solar panels. But if we sacrifice communities in the same way that the fossil fuel industry has done while those critical minerals are being procured, then we're going to run the same risks. On adaptation, we need health in national adaptation plans, and in the discussions that are ongoing on an adaptation framework, the global goal on adaptation, we need health indicators both for the health sector, but also health determining sectors like food and agriculture. There are technical experts that have been appointed, but at the moment they can't be as effective as they need to because they need additional guidance from governments on how to select indicators. We need to make sure that those indicators are measured in a way that don't mask inequalities. So they need to rely on disaggregated data, and they need to report progress that's being made for the most vulnerable populations in addition to general populations. And finally, those indicators need to be selected based on the needs and priorities of people who are most affected. As I've said, the loss and damage fund is no use unless there's money in it. So the loss and damage fund needs to be capitalized, but also there is pressure on governments to examine mechanisms to make sure that that finance is effectively delivered to populations that are most impacted, that it gets to where it needs to. And it's also useful to mention that most health impacts of climate change are classified as what the UNFCCC refers to as non-economic losses. The fact that they are non-economic is a reflection of the fact that public health is not something that can be traded in the same way that food might be able to be traded. But nonetheless, it has a price tag. So we absolutely need to make sure that finance addresses non-economic losses in addition to economic losses. This is my last slide now. On agriculture, the promotion of agroecology and reduced dependence on health and climate harming agrochemicals offers opportunities both for the climate and for health. We can improve food and nutrition security, including by reducing food loss and waste, which will also help us to reduce emissions. That's identified as a key area of opportunity by the IPCC. And again, developed countries need to reduce emissions fastest, including with the phase out of industrial agriculture. On integrity, as I've already said, there are lessons that can be learned from other unhealthy commodity industry regulation, like tobacco control, like alcohol control. And we need to bring this into the UNFCCC space. And then underscoring all of this, unless we have collaboration with the most impacted communities, we can't guarantee that any of these solutions are going to be solutions for those that most need them. So I will stop there. Thank you so much for your time, and happy to discuss more as we hear from the other panelists too. Thank you.
Yeah, thank you very much, Josh, for that very detailed presentation. Clearly giving clear information about what we should expect in COP this year. Like you said, there was last year in Dubai was a major milestone for climate change and health, where we had the health, climate and health declaration, and that was a major milestone. And like you said, it's a foundation that we can build on. We don't need another declaration this year. All we need is to build on that and make sure that that is well implemented. Yeah, so you spoke about a lot of things. You talked about the declaration in Dubai last year and the need for us to focus on to build on it. And you talked about what we should expect in COP this year. The COP this year is a finance COP. And we have to make sure that those that need to provide the money to reduce the impact of climate change, they do the talk. It's not just, we can't just be going to COP every year to discuss without having commensurate action to those discussions. So it's very important that they commit finance to the words they've been giving, or to what the discussions we've been having in COP over the years. So the COP this year is a finance COP, and we hope that countries will pay their fair share of their commitment to climate change and health during COP this year. You talked about WHO special reports on climate change and health that we're going to be having most likely at the WHO pavilion at COP this year. And I talked about the other programs that will be taking place at COP this year. Talked about the recommendations that include importance of countries having health embedded in their NDC. This is very important. A lot of countries don't see health as a climate issues. They don't understand clearly the impact of climate change on health, and they still see climate change as more of an environmental and agricultural or an energy issue. But like I used to say, climate change, the impact of our climate change affects every aspect of health, and there is need for us to for countries to start embedding health in their NDCs. But the one of the issues I have with that is there is an urgent need to build capacity at the country level, because you need to understand what the impact of climate change on health is before you can effectively articulate it and include it in your NDC. So capacity building in that area, I think, is very important. We talked about enabling finance. We talked about just energy transition. We talked about holistic adaptation, loss and damage response. It's very important. We're having increase in frequency and intensity of extreme weather events, especially in African countries that lacks the capacity to cope with such level of extreme events. So loss and damage is very important, and we have to start putting more fund into loss and damage and let the communities that are severely impacted by this extreme weather have a chance to survive and come back. You talked about resilience and sustainable agriculture and ecosystem. Like I said, this is very important for Africa too. The population of Africa is growing at a very high rate, and we need to improve on our agricultural system, especially with the climate impact, to make sure that we don't start having challenges, or we reduce our challenges with nutrition and availability of quality and quantity food for Africans to consume. I talked about enhanced integrity and collaboration with those that are impacted most, especially the communities. You have to find a way of bringing the communities into these discussions, because they're the ones that face the direct impact of climate change and climate extremes. So thank you very much, Jess, for your contribution. It's very informative, and I've learned so much, and I'm sure our participants will have one or two questions for you too. So I hope you will be able to hold on for some few minutes and respond to their questions. Without wasting much time, we'll go straight to our next speaker. Our next speaker is Dr. Adungna Uyesa Gemeda. I'm sorry if I didn't pronounce that well. Dr. Gemeda is a senior researcher at Ethiopian Public Health Institute at Addis Ababa, Ethiopia. Dr. Uyesa is a senior researcher and epidemiologist at the Ethiopian Public Health Institute. He greatly contributed to filling knowledge gaps in island malaria and informing Ethiopia's malaria program. Dr. Uyesa developed malaria surveillance tools available online for monitoring the influence of climate elements of malaria incidence in epidemic-prone locations. He is currently engaged in evidence generation and giving technical support to the Ministry of Health, Ethiopia, in developing a health national adaptation plan. He was the lead author for IPCC ARAL 6, Working Group 2, Chapter 9, African Region from 2019 to 2022. Dr. Uyesa holds a PhD in medical public health and pursued undergraduate trainings in biology at Addis Ababa University, Ethiopia. Thank you, Dr. Uyesa, for joining this platform. I'll hand over the platform for you to make your presentation. Thank you.
Thank you very much for the rich introduction, Dr. Ayodotun. I hope I have pronounced it properly.
You tried.
I tried. Thank you very much. Yeah, my topic of presentation is well presented to the audience through various media. So the COP28 Declaration on Climate and Health and its implications for Africa's health system. So as already introduced, I'm working for Ethiopian Public Health Institute as senior researcher. This institute is going to celebrate its centennial in the coming 2 months' time. I've worked here for almost 2 decades. So I'm very much delighted that I have the capacity to talk to the audience because of the capacity I've earned in this institute and at Addis Ababa University, where I did my postgraduate study. So to start with our communication, everybody is familiar with this rising temperature and variability in precipitation in Africa. So this is Africa we love, Africa we live in, and this is what we are experiencing. This is one of the things we have to take seriously. So maybe this is also one of the inspiring slide. I think I collected this slide from previous works of maybe, I don't know, climate change service. This is presented during COP28, and that was the time when
Hello?
already the day. Can you hear me? Hello?
Yeah.
Shall I continue or?
Yes, continue, please, but we can't see your slide. Can you share your slide, please?
Yes, I have shared already.
No, we're not seeing your slide.
Let me try again.
Okay.
I think my own video is still pinned in case unpinning my video means that we can see Dr. YS's slides.
Okay, okay, you will help us in that regard. Can you see my slide?
Not yet. I'm only seeing your face.
Okay. So shall I share again? Maybe Jesse, have you removed yours?
Should I share from my hand?
Yes,
Let me try again.
Okay.
I think so.
Maybe you should try again.
Yes. Can you see my slide?
Yeah.
Oh,
Yes,
I'm
we
sorry
can-
for
we can
the
see.
technical problem. So I've already said about the topic and about this slide. So during COP28, the temperature in November the daily temperature was 2 degrees Celsius above the pre-industrial level, and that was an alarming, and that was the highest recorded temperature. So this was the COP28 that everybody was very much delighted, diversity and everything. So as introduction, it was projected that by 2050, extreme heat, diarrhea, dengue, malaria together cause 21 million without climate change. So COP28 in Dubai, it recognized that climate crisis is a health emergency. So this was for the first time that, as already the first speaker mentioned, it was considered as a priority, and that was a leap forward for the health community. COP28 has also seen the financing, as already mentioned. The good news that was presented during COP28, as already mentioned by the earlier speaker, 125 countries committed to milestones of this declaration. By that time, 124 countries were committed. Currently, it reached 150. So, as you can see, Dr. Sultan Ahmed Al-Jaber, president of COP28, who was outshining during the COP28, has announced the political declaration marks the first time that the health impacts of climate change has taken center stage in 28 years of UN climate talks. So this is a success for humanity in general, because health is the center of everything. So when we see the details of the health declaration, it has 8 objectives. So it is focusing on transforming health system to be climate resilient, low carbon, sustainable and equitable, and to better prepare communities and the most vulnerable population for the impacts of climate change. So I will directly go to the 5 objectives. Before going to the 5 objectives, I would like to mention that pre-COP for Africa was held in Nairobi, Kenya, and I was one of the resource persons who was trying to contribute to the writing as a team in general, and we're trying to edit, and that was the capacity building for us who joined the pre-COP in Nairobi before a year. I hope it was, if I'm not mistaken, it was in October, and we had really got the opportunity to sit down and discuss with the senior scientists and policy makers and the negotiators. So the first objective of this declaration was that how to develop policy and implement, especially focusing on mitigation and adaptation. That takes indigenous people, local communities, women, children, youths, healthcare workers, and practitioners, people with disabilities, and the most vulnerable. For your information, of the 7 hotspot areas globally, 3 of them are located in our continent. So we are the one who have to be spearheading the adaptation and the mitigation of the health impacts of climate change. The second objective is to bring into the system One Health approach. You are very well familiar, and there are a lot of people who are well acquainted with this One Health approach. This framework is dealing with environmental determinants of health, like strengthening research on linkage between environmental and the climatic factors, antimicrobial resistance, intensifying effort for the early detection of zoonotic spillovers as an effective means of pandemic prevention and preparedness and response. The third objective is focusing on climate resilience and successful adaptation. And the fourth one is how to improve the ability of health systems to anticipate. That means, as you can see from this graph, if you detect early, that means anticipate and detect early, we are in a position to avoid or remove this blue parties for us to be successful in avoiding the impacts. The fifth one is promoting a comprehensive response to address impacts of climate change on health. It could be mental health and psychosocial, medical knowledge, loss of livelihood, culture, and climate-induced displacement and migration. The sixth one is combating inequities, which is already widely available among countries because of historical issues like colonialism, pursuing policies that work accelerating achievement of the Sustainable Development Goals. We are very familiar with the protection system, food security. All those are interconnected, and these inequalities could also contribute how we are adapted to or mitigating the climate impact. The third one is promoting steps to curb emissions and reduce waste. A lot of things that varies along countries, strengthening trans and interdisciplinary research, cross-sectoral collaboration at all levels, at global, regional, national, sub-national, and at different levels. Sharing of best practice and monitoring of progress at the climate and health nexus, including this could be a good example. Alliance for Transformative Action on Climate and Health is one of the things that we can mention, because most of us are joining this platform and there was the opportunity to get trained because capacity is an issue. Maybe the interdisciplinary research is one of the emerging areas in Africa. And next month, there will be a conference that is going to be organized in Nairobi by a team working on this. And I've joined their first Zoom meeting, and there is a team working, specializing on this one. And we have to be vigilant how these are going to help our contribution. Eliminated these parts, financing is one of the things. The declaration is there. Middle income countries, they have to have capacity building, or maybe there has to be a system in which we can have leveraging synergies at intersection of climate change and health to improve efficiency and effectiveness of finance flows. That means absorption is one of the challenges. Even managing and absorption of the finance that could be available is a challenge for some of the settings. So under this one, investment in climate and health from domestic multilateral climate funds, financing, investment, philanthropies, bilateral development agencies, and private sector.
Am I the only one who is not hearing him well, or it's everyone?
Hello, Dr. Uyesa. You can't hear what you're saying. I think the network is not. Hello, Dr. Uyesa, can you hear me? We can't hear what you're saying. There's an issue with your network. I'm very sorry to our audience for that break in transmission. I think he has an issue with his network. We'll give him 1 or 2 minutes to adjust. If not, we'll go to the next speaker, while we hope that he'll be able to come back online as soon as possible.
I'm sorry if there was a technical glitch. Yeah, this is a slide where I lost my connection. So sharing best experiences. Can you hear me? Hello there.
Yeah, we can hear you.
Yeah, thank you very much. I'm sorry for the interruption. I had internet disruption because somebody called me. Improving monitoring, transparency, and evaluation of efforts of climate finance, including climate initiatives. So those are the areas identified. Okay, my slide is not moving. Let me. I'm almost all through, but from their side, and I can proceed. Hello?
Hello, Dr. Uyesa. Can you hear me now?
Yeah, the slide, yeah,
Your
let me
network.
unshare, let me stop. Yeah, my slide is not moving. Okay, now it is moving. Wonderful. So the other area that COP28
we cannot see your slide. I think you have to re-upload your slide, then say it's present.
Okay. Let me stop sharing and then.
Yeah.
Maybe I should make a suggestion.
I shared the slide. Can you see it?
It's coming up, but we can't see it yet. I think it's trying to load or something.
Can you see my slide?
Not yet. Okay, yes, we can see it now. Hello, Doc, are you still there?
I think you should put off your video to make the
hear.
network better.
Okay, I think we'll go on to the next speaker, Dr. Vitalis. I think he's online. Let's have Dr. Vitalis speak while we await Doc to get back online. I'll make a short introduction of Dr. Vitalis, and then I'll hand over the platform for you to make your presentation. So Dr. Vitalis Goodwill Chipfakacha. I'm sorry if I pronounced that wrongly.
No, don't worry about it.
Is the Deputy Project Coordinator for Stage 55 Africa and currently serves as the Technical Advisor for Capacity Building and HIV Mainstreaming at the SADC Secretariat, a public health physician.
So, I've left with 2 slides.
Oh.
Can you see? Can you hear me?
Oh, are you back on?
let him go.
Okay, please go on with your last two slides if you can see it now. Hello? Dr. Dugna, can you hear me? I think he's still struggling with its internet connection. I think, Secretariat, can you bring down Dr. Aduga and let Dr. Vitalis give his presentation?
Yeah.
Dr. Vitalis, you have the floor, please. I think your audio is muted. Can you unmute, please?
Good morning, good afternoon, good evening. My slides are with you already. I would really, really appreciate if somebody was to put them on and then I start talking to them. I'm a public health specialist from Zimbabwe, but I'm based in Botswana, like you said, Dr. Babodoye. Earlier on, somebody said to me they could do it from there because I sent the slides last week.
Yes,
Is that possible?
The Secretariat will upload your slide now.
Thank you so much. And I also maybe will take away my video. I don't want to get into problems along the way. But maybe before the slide comes on, health has always been, for me, the last kid on the block when it comes to most of our development issues. If you look at disaster risk reduction, it was not only not part of it, but was only allowed to come in as a response until the Sendai conference. We are seeing the same also now in climate health, that health is just being brought in now. And yet it would have been very important to have health right from the onset, because whatever happens, it always ends up at the end with health. So I think it's time we learned that whatever new thing comes, health must always be at the top of the agenda. The second issue, I think I heard it from the first colleague, Jess. There's a question which I hope when you're going through my slides, you'll be asking yourself, is Africa aware of all these issues that we are talking about? Because I think that bothers me a lot when you go around talking to people. For them, climate change is a northern problem. And they actually think we are suffering because the north is producing too much green gases. Whereas we also are playing a part. And unfortunately, our communities in Africa seem not to understand that we also play a role. And I think that's an issue we should really deal with and try to make sure that from the lowest person in Africa to the highest person, they all understand what we are talking about. And this gap is probably where we really have a problem, because all these things we are talking about, the common man, the lay person, has no understanding of it. And how do you expect them to respond to whatever we are talking about if they are not aware of what is happening? I've gone to schools, I've talked to a lot of old people. They will tell you, oh yes, during our time, we had a lot of flooding, but it used to happen 10 to 20 years apart. Now we are seeing it more often. And if you ask them, why is it happening? They have no idea. And it's because we have failed, I guess, to make them aware of what is happening. Is my slide, are my slides coming? Hello? I don't know whether I could.
Just a minute, I will share it now.
Thank you so much. Okay. Thank you so much. All right, the next one, please. Oh, I can control them from here. That's very good. Okay. This is the outline of my presentation. Oh, it's not moving. Unfortunately, it's not moving. I don't know what's happening here. Yeah. So this is the outline of my presentation. I will look for Africa. Then we look at the African contribution to climate change, the health impacts, climate financing sources, and the health impact of climate change in Africa, opportunities and challenges, and then probably the conclusion. It's taking quite a lot of time for change to occur. The next slide shows the map of Africa. We are looking at 53 or 54 countries, depending on your political affiliation. Now, out of these 53 countries, 42 African countries are in poverty as we speak. And out of the 42, 16 have poverty, which is still rising. There are 22 middle-income countries, 26 low-income countries, and only one high-income country, the small island of the Seychelles. Now, this has a major impact on health. It has a major impact on finances, and even how to use the finances that you get from elsewhere will also be impacted by the very issues that I've just talked about. Now, under the Africa is the African Union. The African Union is where most of the ministers meet once in a while to talk about these issues that right now we are talking about. And policies, I hope, are also developed at that level. But under the African Union are 8 regional economic communities. Can you go to the next one? Yeah. These are the 8 regional economic communities that are under the African Union. The regional economic communities also have got regular meetings where ministers of a particular sector meet. So we have environmental ministers meeting, we have health ministers meeting, and this is a platform where one would think not only would they talk about the issues we are dealing with here, but also how to deal with finances. And if they could use these platforms, I'm sure we could actually reach better. And this is also a platform where they can also exchange information on how they are dealing with the issues that we all face on the African continent. Next one. Now, for me, there are four African afflictions that we need to deal with before we do anything about development. The first one is siloization. There is so much duplication of efforts where a lot of money hemorrhages. The institutional conflicts, wastages. Then the second one is projectization. Everything in Africa is either 3 years or 5 years. After that, there is no way of knowing whether it's going to continue or it doesn't. This creates community disappointment, and we've seen it with many health programs where programs come 3 years down the line, they disappear, and then communities are wondering what has happened. There's no sustainability, as it were. And then most of these are also donor funded. Then, of course, the last one is corruption, where funds usually disappear. You have limited commitment from your politicians. Projects are never finished. And then in the end, you have a collapse of a system. A friend of mine was saying, I should have added a fourth one here, which is the intolerance of African governments towards non-governmental organizations. Because if you look in other continents, non-governmental organizations are the ones that are right at the bottom of the pit. They are the ones that help communities. And yet, for reasons unknown, very few African countries actually trust NGOs. Next one, please. Now, what are we producing as Africa as greenhouse gas. Carbon dioxide, which comes from plant respiration, from our own respiration, and it's the main contributor actually to climate change. Then we also have burning fossil, large-scale deforestation, which we have seen. I mean, people have been complaining about the DRC and elsewhere. The methane, which comes from decomposition, the nitrous oxide. We have a lot of cattle farming, rice farming, commercial and organic fertilizers, which we are using at a very high rate now. Now, I'm not so sure whether we ourselves have been exposed to understand that we are also producing these gases that are adding up to the global gases that are creating the problem that we are seeing. And I think we need actually to start making sure that the Africans understand that whenever they burn a field to grow in summer, it might actually have an impact on climate change. Next one. These are also some of the the energies that the non-renewable energies that we have. We produce a lot of these and we use a lot of these. Now, when you come to me and say there is green energy, what will I do with the coal that I have? And I'm not so sure how many of you have noticed that in every country in Africa, probably 50% of the electricity is produced through coal. Now, if we were to go green or we had to stop using this coal, what then would happen to our development? So already, because of our poverty, already because we don't have the monies to change or mitigate these issues, we already have a problem. And that will force us to continue on actually using these non-renewable energy sources, creating a bigger problem later for Africa. Next one. Next. Yeah, keep on, continue on until the slide comes. Yeah. When I look at Southern Africa, the extreme weather events due to CC are hydrometeorological. We have flooding and we have drought, and in the end, we also have diseases. Waterborne diseases, vector-borne diseases. I think I've got a slide which is showing these vector-borne diseases. But there are also other events that actually people usually do not talk about. I went to one country once and the old man comes to me and says, do you realize that all the 6 people who died because of the flooding here were bitten by snakes? And I must admit, I really didn't know. But local people will tell you that people die of something else and not of flooding. And these are issues that I think we also in Africa need to take into perspective. Some drown, the others are hit by logs that are floating in the rivers. Some other accidents happen. You have animal attacks, which are crocodiles and hippos, because they themselves also are displaced. And these should be part and parcel of what we talk about when we are looking at extreme weather events. Only last week in South Africa, we lost 3 people in the Eastern Cape who the water was rising in the houses and they wanted to switch off their electricity so as to get the televisions away. And they were all electrocuted. And yet we don't train people actually that when flooding is coming, don't touch any electric appliance, don't do this, all this. And a lot of people probably are dying because of these small little things. And yet they are not part of the package when we are talking about extreme weather events. Next one. This one, I think we can pass on. Next one again. Now, the health impacts in Africa of climate change are in many groups. The first is maternal health problems. You have miscarriages, premature births, and anemia. The first 2 is definitely stress, because when you have extreme weather, you have stress on mothers who are pregnant, and we have these consequences. Anemia, of course, they're not eating enough, they're not getting enough of the iron they need. You have also increased gender-based violence, and this probably comes because men are angry, because they have failed maybe to protect those around them, or simply because they are forced to be in one room or one place where they can't move around to do other things that they wanted to do. We have food and waterborne diseases. We have increased risk of food insecurity and district mental health and well-being, and of course, community development that we see quite a lot. And this also has a major impact on health in the sense that when you are running away, you probably do not take your HIV medication, BP medication, your diabetes medication, and it will have a major impact on health because of the extreme weather and you're running away from your usual abode. Next one. This is nearly the same, but I'm looking at it from a different perspective. I have a climate-related hazard as first, then we look at the social, economic, and political vulnerabilities, okay? Then at the end, you are looking at the resulting disparities in health impacts. And I think Jess was talking about this as well. In Africa, especially, you have this greater heat-related morbidity, which we are seeing, and mortality, increased morbidity and mortality during disasters, greater prevalence of food deficiency, and greater vulnerability to food and waterborne diseases. But we are seeing in a country like South Africa, people are also dying of the effect of cold weather. We had a lot of snow last month in South Africa. I'm not so sure whether there's any other country in Africa which also had the same problem, but I'm sure countries in North Africa might also have the same problem. Next one. These are the diseases that are caused by vectors that also are increased whenever there is climate variability. And climate variability comes when it's either too hot, it's too cold, and so forth and so forth. So we've got malaria, sleeping sickness, schistosomiasis, leishmaniasis, lymphatic filariasis, dengue fever, yellow fever, and plague. And we have seen these also actually happening whenever we have problems. And cholera is one of those actually that we are seeing, particularly in Southern Africa. Next one. It's the same here. Next one. So what opportunities do we have, therefore, for financing on the African continent? I made a few suggestions. The first one is government can sell what you call climate bonds and create finances from this. The second one is environmental weather fees. I saw this last week where South African Airways in Zimbabwe, they actually wanted to attach their property because they have not been paying environmental weather fees. Because airplanes fly in Zimbabwe, the Zimbabwean government is saying you are the ones who are polluting our air, so you need to pay for us to deal with that position. So countries can actually create this and make sure that every airways that comes into their country, it pays a particular fee, and that fee then is used for climate and is also given partly to health. You could also create micro levels for contribution to climate change. And my suggestion would be governments should look at those sectors and say which sector is having a major impact on our climate change, and then calculate according to that how much they have to pay. You have the agricultural sector, which plays a very important role in producing green gases. You have the mining sector, the transport sector, the energy sector, and of course, the biggest culprit who seems not to pay is actually the government itself. They have more vehicles probably than anyone else. They also have got airlines, and I'm wondering whether they themselves are also paying the same fees that others are supposed to pay. So it probably is necessary for governments to be also responsible for some of the micro levies that we can put up in the countries. I know in Zimbabwe also you pay carbon tax. If you are driving from outside Zimbabwe, you pass through their borders, you pay the so-called carbon tax. Donor funding is also what probably a lot of our countries are relying on. But I'm one of those people who actually believe that we need more domestic funding than donor funding. This is our responsibility. This is our problem. We need not be saying other countries should be funding us. You could create drought insurance. I've seen some groups now are doing that in a lot of African countries and use that money to finance health. And then crop and weather insurances. Next one, please. Oh, yes. Public-private partnerships are critical when it comes to financing. And I think a lot of our African governments must start learning to say they work together with the private sector to get finances. Next one. This is our biggest challenges that I think will have a major impact on what we are all trying to do. And the first one for me has always been ignorance. Are our people understanding what needs to be done? And I think my next slide will see who needs to be aware of what's happening in our countries. Because of poverty, because of corruption, because of other issues, we have very weak healthcare systems. We have weak healthcare infrastructure, limited health funding, limited investment in both health and climate change. We have inadequate domestic funding in whatever we have in our development agenda. We have too many development priorities, limited awareness and understanding at all levels, rising demand, increased out-of-pocket payments. Now we are forcing our people to pay out of the pocket, which they don't have. So they stay away from actually coming to a health facility. We start cost sharing. There's so much bureaucracy sometimes that if you want something done, there will be problems because of the bureaucracy that we see. Limited and no community-led responses at all. This is where I thought NGOs could play a very critical role in most of our countries. And of course, limited transparent processes. Do we know where the money is going and so forth and so forth? So who should be aware of what we are talking about here? For me, the first priority is the communities, because all these things are happening around them, but most of the time they don't actually know why it's happening. But we also need our policymakers to understand what's going around us. The legislators, the academia, the students and their pupils, traditional leaders, politicians, educators, and the skilled personnel. We're talking of agronomists, the security people, and transporters. I was in Fiji a few years ago, and I had a very interesting encounter at a primary school where a grade 1 student was telling us about what causes climate change. And I was really impressed. And I go back to Africa, go to a secondary school and ask a secondary school student the same question. And believe it or not, had no idea what I was talking about. And that shows you the difference between particularly island states and most of our African countries, because they really do not understand what's happening around them. And we need to start actually doing so. But there are headaches to this, trying to leverage the funding or to make the funding. The first is donor fatigue. For everything that is happening in Africa, we ask for money from someone else. We never invest ourselves, our domestic funding, into it. Then you have also climate change deniers. I mean, I have gone places where people will tell you, but the president of America does not believe in it. And you now have to start to struggle and say, how do I convince this person when the country that I should think really believes in this, helping me to make sure my people understand? The conspiracy theories on CC, especially now with social media, everybody's spreading things that actually will become problems for us when we try to say to people, do this in order to mitigate. Now, who keeps the coffers? If we make money out of climate change, who's gonna hold the purse? Is it the Minister of Environment? Is it the presidency? And will they actually share that money as it's supposed to be? And what modalities are you going to use for sharing the purse? And probably the worst of them all is the ministries of health might actually take the climate financing money as money replacing the money which they themselves should have been putting into the health sector. And if this happens, then we are in trouble. Then, of course, we have contradicting donor policies. We have seen this in HIV and AIDS. This donor comes, they've got their own policies. The other donor comes, they've got their own policies. If people are being financed by donors, are these donors coming with their own policies, or are they following the policies that we find in our countries? Next one, please. This is a slide I always put when I was doing HIV and AIDS, that when you say, let's do something, people will say, but I'm not responsible. And this is what we are seeing here. The two guys at the front are scooping water out of the boat in which all the four people are. And yet the two at the back, I'm saying, I'm glad I'm not, the hole is not where I am. And yet logic will tell you that if the front guys don't do anything, all of us will fail. Now, continue. The next one. Next, please. Now, for me, this is the critical aspect. Strengthening the resiliency and adaptability of communities. Can you, I hope it works. Go forward, let's see. Yes. This is how it should be. It should not be. As you see here, you have the up-down approach, which we should not be following. We should be having our communities tell us what we are supposed to do. And this is the next one. Try it again. Yes. This is what we should be doing in Africa. Our communities are the ones who should be telling the village elder, the district people, the national people, and the supranational people what needs to be done. As long as we do what we saw before, I am sure we will not be able to actually convince people to even pay the levies that we have been talking about. Next one, I think that's the last one. Thank you so much. Yes, that's the last one. Thank you very much.
Organizers, can I summarize the presentation in 2 minutes?
Okay, you can go on before we have the final summary.
Yeah, because otherwise I'm distracting the people who are attending this platform.
Okay, please, you have the floor for 2 minutes.
Yeah. Okay, can you see my slide?
Yes, we can.
Thank you very much. I'm sorry, all the audience, for the distraction we had. I was trying to communicate the reflections from WHO. WHO was trying to put how the magnitude of climate is a problem, and the success stories of the COP28, $1 billion was pledged for climate and health, and UAO announced it has aggregated financing of 1 billion by that time, and 124 we have mentioned countries that have endorsed it. So these are the key slides to summarize what I've presented. The previous one are 8 objectives, and the financing implications, the policy issues. That means we have to have climate into our health plan and with other sectors. So when we see the African health system, how is the capacity of African health system is in assessing vulnerability and adaptation to climate variability at national and subnational level? Countries are at various levels of capacity in doing their own VA assessment. How is the commitment and engagement of institutions, both at academia and research institutions, to foster interdisciplinary health research to inform climate health nexus? As my brother, previous speaker mentioned, the commitment and engagement is very important. As academic and research institutions are the most heard and have evidences with them, they have to be as the center of the activities in interdisciplinary research and how to change the communities' situation rather than putting a piecemeal of solutions related to adaptation. So the other thing is the health impacted community has to be at the center of are they at the center? Are they taken into account? Practical steps to improve input for policy development and the revision such as quality data and analytical competency and interpretation, which is going to influence policymakers and the decision makers. We have to see how is the implementation status of COP28, in which the words, the statements are pleasing us, and we are very much delighted there is a declaration. But this has to be changed to practice and action. The platforms for collaboration and partnership related to new initiatives like One Health approach. This is one of the new approaches, but we are not quite sure how to do them because there is the silos, as already my colleague, the previous speaker mentioned. So we have to see where we are. The status of Africa's regional and sub-regional collaboration as the most affected continent. Are we connected, or each country is, or sub-region is doing separately? We have to see how we are moving forward. This platform, GATE platform, is one of the opportunities for us to come together and to be a voice to change the declaration into guidelines and then standard operating procedures and actions. Finally, the way forward is how is the implementation status currently? A year before, we had a declaration that we have looked for more about 3 decades. In the last 11 or 12 months, what have we done? I know WHO, Afro, and some partners are making their effort. Is that enough compared to the magnitude of the problem? How are parties engaged and monitor progress of implementing the declaration? Because they have recognized, we'll review our progress. The statement is mentioned. How is the status? Thank you very much. I'm sorry for wasting your time in trying to fix everything. Thank you. I'm done.
Thank you. Thank you very much, Dr. Adunga, for your presentation. Very detailed and very interesting. I also want to thank Dr. Vitalis too for that very thought-provoking presentation.
Dr. Bobade, can I ask a stupid question though? Do you realize that there is a conference on climate health on Africa taking place in Zimbabwe since today? I think it's for the next 2 days.
Yes, I think I was invited for
excellent.
My own conference is next week, so
okay. No, that's good.
Of serious preparation.
I'm glad to hear that.
Thank you very much, Dr. Vitalis. A summary of both presentations. Dr. Adunga focused his presentation on the declaration at COP28, declaration that he said 150 countries are now committed to that declaration, and we are in the process of implementing that declaration. It made two very important thought-provoking questions at the end of his presentation. How far have we gone with the implementation, and how well are we collaborating to make sure that it's not just a document, but it's something that will translating from being a document to action that will impact everybody at the national, regional, and even at the community level where the impact of climate change is felt most. So Dr. Adunga talked about the objective of the declaration, which is eight different objectives: strengthening the development and implementation of policies. Talked about the One Health approach, which is very important, as integrating human health, animal health, and plant health. Because there's no way we can talk about health without talking about our environment. A man is only as healthy as the environment he lives in, the food he eats, the water he drinks, and the air he breathes in. So the one-let approach is very important for us to address emerging health issues all over the world. And that is what of the approach that WHO and other relevant international organizations are clamoring for now. Talked about recognizing that health population contributes towards an effective climate resilience, combating inequalities within and among countries. Talked about promoting steps to curb emission and reduce waste, which is very important. Like the other speaker said, Africa too is beginning to contribute to, or where contribution of Africa to greenhouse gases, though it's still relatively, it's still very small, but at least is increasing, and we have to contribute to mitigation too by reducing our carbon emission. So these are the other objectives are the objectives of this declaration. And the thought-provoking questions are, how is the implementation, what is the state of the implementation? That's a year after the declaration, and how are parties engaged and monitoring, and are they monitoring the implementation to make sure the declaration?
Hello, sir. I think the last speaker, Dr. Andrew Jiteko, is here. I don't know if he would still like to go ahead with his presentation.
Okay, fine, we'll go ahead. We'll take him after the summary. So the thought-provoking questions are, how is the implementation, what's the state of the implementation, and are the parties engaging to make sure that the declaration is well implemented? And for those that will be going to COP, that is one of the things that they should take very important. I was in COP last year during the declaration, but I will not be going to COP this year. But for those that will be attending, they have to push the negotiations and make sure that the climate and health declaration is not just a declaration, but ensure that policymakers all over the world, especially the 150 countries, are committed to it now. They're also committed to implementing the objectives in their countries and put down the necessary finance to make sure that the declaration is well implemented. And for Dr. Vitalis, he talked about the economic challenges in Africa and some other challenges. Talked about African countries working in silos, which is a big problem in Africa. And imagine African challenges like climate change, you just have to work together, understanding the concept of transdisciplinary. You can't work in silo to address emerging global challenges like climate change. You need different departments and different sectors and different part of government to work together to address it. Talked about sustainability of projects on the continent, and he talked about the big issue of corruption affecting African countries. He also talked about the greenhouse gas emission, which we need to reduce, the extreme weather events and their impacts on human health, flooding, droughts, and desertification, snake bites, drowning, accidents, and other forms of events in Africa and their impact on human health. He talked about impact of climate change on different aspects of health, on maternal health problems, and that brings us to gender issue when we talk about climate change and health, which is very important too. Climate change increasing gender-based violence that has to do with climate change and mental health, which is an area we have to look at too. Food and waterborne diseases has to do with climate change and its impact on waterborne infectious diseases, especially waterborne and food-related diseases, and talk about climate change and health and food insecurity as it affects food production, both quality and quantity of food that is produced. And the opportunities, very important. We can't just be talking about climate crisis without understanding and maximizing the opportunities that climate change offers. Climate change, like I used to say, is an opportunity to develop in a different direction, and we have to maximize the opportunities that climate change offers too. Talked about climate bond, carbon taxing, donor funding, which is not reliable. Talked about drought insurance and crop and weather insurance. We have to start taking insurance very serious, especially with our farmers and those that are doing climate sensitive jobs. Climate insurance is becoming something that we have to take very serious in Africa. So that's a summary of presentations from both doc. We sincerely appreciate your presentations. They are very thought-provoking. And without wasting time, we'll go to our last speaker for the day. Our last speaker for the day is Dr. Andrew Giteko. I hope that pronunciation is correct. So I'll do a brief introduction and I'll hand over the floor to you. Dr. Andrew Giteko, PhD. After obtaining a BSc Chemistry and Zoology, Andrew Giteko joined Kenya Medical Research Institute as an assistant research officer in 1982. His major area of research was malaria and other parasitic diseases. He then proceeded to undertake a master's degree in applied parasitology and medical entomology, and a PhD in medical entomology at the Liverpool School of Tropical Medicine in UK. During his field research, he observed the devastating effects of malaria epidemic in the Western Kenya Islands during the 1992 to 1994 El Nino, and he started investigation on the role of climate variability using mathematical models on the evolution of the epidemics. The models indicated that increased temperature and rainfall initiated malaria epidemics, and as a result of this work, he was nominated for the UN IPCC by WHO in 1998. Following the 1997-98 El Nino, and with support of International Research Institute, he developed a weather-based early warning system for forecasting malaria epidemics in the islands of Western Kenya. Dr. Giteko was a lead author and contributor in 4 IPCC Intergovernmental Panel on Climate Change reports and a review editor in the Millennium Ecosystem Assessment, MIA. He and colleagues received the Nobel Laureate Award for the IPCC contribution and the Zayed Diploma for the MIA contribution. Dr. Andrew, thank you for joining us on this platform. I say karibu to you. Please, you have the floor, please. I think your audio is muted. Can you unmute? Dr. Andrew, you are muted. Can you unmute your audio? We can't hear you.
Unmute.
Fantastic.
Can you hear me now?
Okay.
Very good. Now, yeah. Okay. Yeah, I was explaining that I was unable to connect my tablet to the webinar. But after some time, I said, let me try my phone. And this is working. But I won't be able to share the PowerPoint presentation because I don't want to disrupt the talk. So as I had been assigned to discuss about the impacts of climate change on disease and health. Now, I'm just going to be open with the general statements about the impacts of health, of climate change on health. And what we have observed after many years of research is that the general impact is causing epidemics, such as malaria, Rift Valley fever, cholera, and so forth. It's also climate change modifies seasonality. You know, sometimes you get epidemics at a time when it's supposed to be a dry season, such as caused by El Nino. And one of the problems with climate change is its unpredictability. So you're never quite sure what's going to happen. That is one of the big problems. So you can have an outbreak at unexpected time. because of its unpredictability. Then the other thing that we see is expansion of geographic range, such as malaria going up in altitude, going to the highlands. We've seen Rift Valley fever moving around from its original endemic areas and is spreading to other areas. Of course, cholera has spread quite because of flooding and so forth. And then, because sometimes when epidemics occur, they occur in people who are not immune to the disease. These are immunologically naive. And usually when they get these diseases, the outcome is very severe. We see that in malaria. Normally we see severe diseases in young children, but when you get epidemics, it occurs in children because they're not in adults, because they are not immune to this thing. So those are the general impacts of climate on health, particularly in Africa, where we have all these vector-borne diseases. I heard at the end of your presentation, people talk about crop failure. Of course, this leads to malnutrition and undernutrition, but far worse than that is that it causes both physical and mental stunting. That's permanent. If you don't get enough nutrition at the early age, you are likely to, your body may not develop as it's supposed to, and even the mind may not see its full capacity. Now, climate change is you talk about big populations, continental level. So you can imagine the numbers. If you're going to have people who are stunted, both physically and mentally, it's really serious. So we must consider all such things. Then, of course, you have extreme weather, disasters such as landslides, drowning, loss of livelihood, and so forth. People in West Africa, you saw the floods in Nigeria the other day. Today, as I was waiting for this, I was looking at flooding in Spain. It's really bad, massive rain. Rain that's supposed to occur in 1 year occurred in 1 day. And no one was prepared for this. So it's going to cause a lot of problem in Spain. Let me see. And so this is what is likely to happen or get worse in the future as the world gets warmer. We have a lot of water moisture from the oceans, and this water must go somewhere. Some of it will come to the continents, causing flooding and all kinds of havoc. Now, our major vector-borne diseases, as you know, are malaria, Rift Valley fever, dengue, chikungunya, yellow fever. These are the major vector-borne diseases in Africa. Now, malaria, we're having some success in controlling malaria, but recently this has declined for a number of reasons. One is the insects are becoming resistant to the insecticides. That's a very serious problem. Then the insects are also changing their behavior. They don't come to bite at night. They bite early in the evening or early in the morning and they run away. So the interventions are not working as well as they should. So that's a serious matter of concern. We have Rift Valley fever, which is an epizootic disease. It affects both humans and cattle. And one of its serious impacts, it can kill 90% of livestock in a single season. Now, for nomadic people and people who keep livestock for their livelihood, this is very bad because they get food from milk, meat, and they earn money from these animals. So it has a bad impact on them. Now, dengue and chikungunya is another worrying issue, because these two diseases are spreading very rapidly worldwide, not just in Africa. In fact, in Africa, we are lucky it has not spread as much as we thought it would, but it is increasing. It is not quite clear why this is happening, but more rain means more breeding habitats. Warmer weather just makes mosquitoes breed faster and the virus transmission go faster. So theoretically, these two diseases should be affected by climate change. Yellow fever, again, is transmitted by this Aedes mosquito, and you need water and high temperatures for its transmission. So those are the vector-borne diseases. Now we go to waterborne diseases. I think everybody is familiar with those ones. Cholera, you know what happens when it rains, and all the where you have low sanitation, people use pit latrines, those become flooded, the water becomes flooded everywhere, it gets into the drinking water, and you have disaster. Then you have typhoid, it's the same route as cholera, again, fecal contamination of urban water, public water supplies, and it's terrible. Then you have the Shigella, that's a bloody diarrhea, quite bad. It's again waterborne disease. Then you have E. coli, which is a bacteria, and it's transmitted through water contamination and food contamination. It can spread very fast during floods. And then, of course, we have the virus one, hepatitis A. It's another waterborne disease. And then we have some other diseases which are caused by cysts, such as amoebiasis, giardia, cryptosporidium, and so forth. So those are waterborne diseases. So when we have floods, you can expect this to happen. But in fact, it's not only during times of flood. When there's a drought and people don't wash their hands, poor hygiene, then some of these diseases will start spreading, such as cholera, E. coli. Actually, most of them, if you have poor hygiene, then you are at high risk. Okay. Now we go to this one. Now, this is what. Okay, airborne diseases. You people from West Africa, you are familiar with this one. There's the meningitis belt, a disease that I think it occurs during Hamilton in a very dry period. So the hotter it is, the higher the risk of meningitis. I remember one time traveling to Burkina Faso, Ouagadougou, and as soon as we got off the plane, quite a few people started having nosebleeds, and also the lips were bleeding because it's so dry. Your lips just crack and inside your nose, so you bleed, and that's how you get meningitis, because it's airborne disease. So you breathe this pathogen, and it gets into your blood through your nose, and if you have cuts in your mouth because of this very dry weather. So this is what will happen. But there are other diseases, respiratory diseases. People who come from the highland areas like Kenya, we are always being told, cover your chest during the cold season, because people knew some of these diseases are linked to the weather, such as, what do you call them? Such as, pneumonia. But you have other diseases. Pneumonia is caused by different pathogens, bacteria, viruses, fungus, and they are associated with the weather. So we still don't understand exactly how the mechanisms, because they're different pathogens and have their own different pathways of transmission. Okay. Now, number 7. Of course, then there's very obvious ones because of physical injuries and mortality caused by things like flooding. You have landslides in mountainous areas. You have forest fires. And what is this one? Sorry, there's something going on. Anyway, these are conditions which are caused by flooding. I think everyone is familiar with this kind of things. Okay. Now, in terms of primary healthcare, what can we do, or rather, what should be done at the primary healthcare level? That's what's going on in the health centers in the villages and in the local areas. This is where you get first-line treatment before things get very serious. When you have a cough, you have a headache, that's where you go to. And generally, vector control should take place at that level, at the village level, by use of insecticides and by environmental management of breeding habitats, where you have mosquitoes breeding in flower pots, you have water containers, which cause the breeding of Aedes mosquitoes. It should be handled at the local level. Then we need to supply the communities with safe drinking water. Water is behind all these diarrheal diseases, and they are not safe diseases. They kill, and very quickly too. So there's supposed to be provision for clean drinking water. Now, if you look at the Millennium Ecosystem targets, they state very clearly the kind of level we should achieve in supplying people with safe drinking water. And this should go in the national budgets. This should have been, this was long-term planning. The government should have foreseen this in view of climate change, and we should have allocated funding for clean drinking water, because this is the source of poor health. Then we need to consider developing early warning systems. We did develop one in Kenya for predicting malaria epidemics. That system can detect an epidemic 3 months, 2 to 3 months before it happens, which means that you can warn the affected populations, ask them to use their bed-nets. You can deploy medications to all the health centers, carry out public health education so that people do not confuse malaria for a common flu. You need to tell them, if you get these symptoms, you need to go to hospital quickly. This is a dangerous disease. So if you have an early warning system, it will help you to forewarn people so that they don't just assume that it's another common flu. It could be a serious disease. And then in some cases where we have vaccines, and now we have vaccines for malaria, they are being used in young children. We have vaccines for yellow fever. We have vaccines for animals, for Rift Valley fever, not for humans. If you foresee a looming epidemic, then you should deploy these vaccines so that you reduce both mortality and morbidity, save lives. Because if you don't do that, then it will result in high morbidity. Oh, seems like I've lost my. Okay. Okay. So, in terms of case management, because once you get sick, you need to go to a hospital. And sorry, something is happening. Oh no. You need to go to a hospital, and when you get to the hospital, they need to diagnose your condition quickly and accurately. So you must have diagnostic tools such as microscopes, rapid diagnostic tools, so that as soon as you get to the hospital, the condition is diagnosed and you start treatment immediately. You know, many of these people delay treatment, and this is what causes serious issues. And then, so we must have diagnostic tools. We must have medicines, the correct medicines. Several years ago, when I started my career, that's about the time when chloroquine became resistant, or the parasites, malaria parasites became resistant to chloroquine. And it was a very dangerous situation because you would go to the hospital, there was no other drug except chloroquine. So you take it, and so you say your prayers. So you must have effective medication and so forth. So that's a must. Then you must have well-trained staff because these are the people who will treat you. So something is happening here. Hello?
Yes, we can hear you.
Can you hear me?
Yes, we can.
Oh, it's just my video has minimized. Can you see me?
We can see you.
Hello?
We can see you.
Okay, good. All right. So these are things that must be budgeted for by the central governments or by local governments. And since we know that these diseases are going to increase, we must take that in consideration in national planning so that we allocate enough money to meet not only the increasing population, but also to the increasing level of disease, which is likely to happen because of climate change. So we can't continue using the old ways of budgeting because that only addresses population change. But now we have climate change as well. So we must take that in consideration in all health policies in terms of diagnostics, infrastructure, medication, vaccines, staff, and so forth. So if our policymakers are not aware that climate change can completely alter the health profile of our country, then we're in trouble because they will continue using the old systems they are using. So now, then we need to look at research. It's very, very important because research addresses current emerging issues, such as drug resistance. We need to keep monitoring our drugs, make sure that all the antimalarials are effective, they are working, all the vaccines are working, so for yellow fever, Rift Valley fever. They need to, sorry, something is happening. Okay. Oops. Right, okay, sorry, my video has gone off. So research is critical. And then we need to understand new and re-emerging infections. Some of these pathogens are changing all the time. For instance, chikungunya is mutating and producing more pathogenic strains as you saw with the COVID, we need to monitor these things to make sure we are not getting any unfamiliar pathogens coming in and we'll be caught by surprise. So research is extremely important in managing this climate risk. Now, to conclude, we need to say a couple of things. One of them is the health sector needs to collaborate closely with the meteorological departments. Usually, it is funny enough, in our experience, these two departments don't talk to each other at all. But now we must talk, because climate is a new added risk to health. And we must understand the climate people. What are they telling us about extreme events, about changing environmental conditions, about changing transmission conditions? We must communicate with them and collaborate with them. One of the problems we have in some of these African countries is that the Met department cannot give you free data. They want you to buy data. That's a policy. That's a global policy. They think they have a commodity which they can sell. But we need to discuss with them and tell them that it's for the benefit of the country, that they collaborate closely with the people in the Ministry of Health so that we can understand better who are the most vulnerable and when these events are likely to occur, so that we can be prepared. Then the health sector needs to improve its surveillance systems so that we are not caught unaware again. You get, because you have geographic range change in diseases, a disease might appear in a place where it did not occur, and people will be completely unaware. So we need continuous surveillance using the hospital-based health data surveillance systems. So that needs to be strengthened in terms of digitization, analysis, interpretation, and conversion into policies. So at the end of the day, we are saying that climate change is here with us, and climate change includes extreme events, and these are likely to increase in intensity and frequency. So we know that's given, for certain it's going to happen. So we must prepare ourselves. So the national budgets must start taking considerations of these new risks. In some way, it's like insuring for any kind of a risk. So they must allocate budgets for the health sector. Otherwise, you have a population in poor health and productive, and that's not. We need to make sure this doesn't happen. Thank you very much.
Thank you very much, Dr. Andrew, for that very important presentation, and we're sorry that you couldn't present your slide. Hopefully, we'll have the slide to share with our participants.
Yes, please.
Thank you very much.
Yeah, I don't know why I can connect through my phone, but not through my tablet.
Maybe
I don't know
something
what's happening
with the connection somewhere.
Yes.
Yeah, I think we're coming close to the end of the program now, of the webinar now. We spent about 2 hours, and I want to thank our participants for being patient in the last 2 hours, and I hope they've learned so much as I have from my side there. Dr. Andrew talked extensively about the impact of climate change on health. He talked that climate change expands geographical range of infectious diseases, mainly vector-borne diseases, the malaria, the dengue fever, the chikungunya, the Lassa fever, Rift Valley, and other forms of endemic diseases we have in this part of the world, and talked about climate change affecting the geographical range of both the vectors and even the pathogens that causes these diseases. Like someone would say, a warmer world is a sicker world. Increasing temperature and other extreme events is affecting the geographical range of diseases, infectious diseases, and also with extreme events like flooding and other things. We're seeing increase in waterborne diseases like cholera, typhoid, E. coli, and other forms of waterborne diseases. And it also talked about the impact of climate change on mental health, physical stability of humans, especially with the impact on quality and quantity of food available, which can be seriously impacted by climate change and can affect mental and physical ability of humans. And he talked about what we can do to reduce this impact. Talked about vaccination during disease outbreaks. He talked about developing a very vibrant early warning system. Talked about rapid diagnostic tools during disease outbreaks, well-trained staffs, research, which is very important, collaboration between health workers and med workers, collaboration even between the One Health approach, collaboration between human experts, animal experts, and environmental experts to effectively address these emerging health challenges and impact of climate change on health. We talked about early warning system. Early warning system is very important considering the increase in frequency and intensity of extreme weather events now. It's very important that we have a very vibrant early warning system and surveillance system to be able to effectively prevent, and respond to emerging disease outbreaks. So thank you very much, Dr. Andrew, for the presentation. We're coming to the end of the program now, but before we'll end this program, let me remind us again of our conference that is coming up next week. GETS annual conference on One Net and biosecurity. The 10th edition will be taking place in Lagos, Nigeria next week. Like I said, we've had this conference in different cities in Africa, Sierra Leone, in Ghana, in Senegal, in Abuja, and we're having the 10th edition in Nigeria, in Lagos, Nigeria next week on the 6th and 7th of November. It's one of the biggest transdisciplinary gathering of experts in One Health and biosecurity in Africa, and I'm inviting everybody to be part of the meeting. You can join the meeting virtual, or you can join in person, join us in Lagos in person. It will be fantastic to have everybody there. And it will be a platform to continue this discussion and discuss more on the area of One Health and biosecurity, and how we can address emerging threats on the continent. So before we go, I'll say thank you to our speakers, Dr. Andrew, Dr. Adunga, Jels, everybody, Vitalis. Thank you very much for sharing from your wealth of experts with us in the last 2 hours. And thank you for joining us. We sincerely appreciate you, and we appreciate the time you spend with us. And also to our participants, I hope you've enjoyed your last 2 hours and you've learned so much. For those that will be going to COP next week, make sure you represent Africa very well in the deliberations and the discussions in COP. Let's continue to push for financing to address emerging climate threats on the continent of Africa, increasing extreme events, loss and damage, and other types of funding, adaptation and mitigation funding, how we can increase it to make sure that we address climate impacts and climate challenges on the continent. We appreciate your time, our participants and our speakers. Have a blessed rest of the day, and we hope to see you at our conference next week. Thank you very much, and have a blessed time. Bye.
Thank you.
Thank you very much.
Thank you.
A luta continua.
Victoria and South Africa.
Yeah. Dr. Andrew Gizeko, I asked your email. I would like to communicate further with you. Can I get your email?
Who?
Dr. Andrew Gizeko?
Yes.
Yeah, your email.
Yeah, you can get it from the organizers.
Okay, thank you very much. Just to ask your permission to use, yeah.
Yes, you can.
Okay.
Yeah, very good.